To that, we hadn't met as individual teams before. So we've done quite a lot of background work in preparation for the workshop. So we're really hoping that it's going to hang together very nicely. And because it's a workshop, we want it to be interactive as well. So we're using a little bit of kind of interactive technology that we'll share with you in a minute. So I'm going to ask each person as part of the workshop to introduce themselves, and I'm going to ask Sarah to begin.
Hi, I'm Sarah Marie. I work with Doctor of the World, France. I've been working with sex workers for many years now, and as a sex workers' rights activist, I guess. Thanks to ESWA for giving us the opportunity to be here.
Thank you. Hi, my name is Ting. I'm from a community from France. It's called Still Roses. It's a self-made organization by migrant Chinese sexual worker. And the fact I'm here, all our community, it's Chinese sexual worker, women. And the fact I'm here because I'm the only one from this community can speak English and French. And most of them are undocumented. So thank you.
Hi, I'm Becca. I'm a PhD student in my second year, and I'm a co-researcher on the SWAN project. And I have 10 years lived experience in sex work.
Hi, I'm Dodds. I'm a co-researcher for the SWAN project, and I have 10 years lived experience of being in the sex industry, doing various jobs from full-service sex work to porn to PSO. Basically, any job in the sex industry, I've done it.
As already introduced, sorry, clap. Yeah, as already introduced, I'm Caroline Bradbury-Jones. I'm a professor of gender-based violence and health. And as the title suggests, my predominant area of research is violence against women and girls. And I led the SWAN project that you'll hear a little bit more about in a while. And the SWAN project is not to be confused with the SWAN that you may be, the SWAN organization that you may be familiar with. It's a distinct research project that we'll tell you about later.
Hi, I'm Molloy. I'm basically just here for technical support today. But I was the research fellow on the SWAN project. I work with Carrie. We're both at the University of Birmingham. And I do a variety of qualitative health research, so mostly marginalized populations and trauma, I think. So, shall we get going?
Let's get going. I'll take this.
You take that. So, this is the bit where I get to start. So we're hoping that this is all going to work, and this is the kind of let's test the waters and see if the technology actually works for us today. What I would like you to do is, if you've got a phone and can scan the QR code, that would be amazing. And that should take you to a question on Menti that asks who you are. So we're not asking for your life story. It is a series of checkboxes. The codes are also on the screens around the room if they're easier for you to get to. The alternative is you can go to menti.com and use the code 19952541. And if you click, that should tell us who is in the room. Now, the question is whether that's going to work for me. Oh, there we go. Isn't it magic? What's the code? Do you want to go back to it? Just poke it every now and again.
Is it working? Yes, you will. I'm not touching it. I don't do technology.
There we go, that's the code again. I should have written all these down on a piece of paper and been like a bit low-tech as well, shouldn't I? Do we think everyone's done it? Wow. Got lots of researchers here today, haven't we? But I quite like the others, and I like the combination of some of the above as well. Yeah. Okay, I'm hoping that's kind of worked for everyone, and anyone who wanted to has done their thing. So we are going to carry on, and I'm going to hand over to Sarah.
Thanks. So with Doctor of the World's France, we are conducting a sex work project in France and abroad. In an harm reduction approach, so we do like service delivery, and we're working with sex workers. Obviously as like outreach workers. The thing is, as Luca mentioned yesterday, sex workers in sexual projects should not only be like outreach workers, but should be also other things in the project, like project officers, maybe members of boards or things like that. But what if we are not a community-based organization, which is the case actually for Doctor of the World France. We're not sex workers-based organization. We do not work only with sex workers. And if we want to go beyond the participation of peers within the team, we can obviously hire like sex workers as project officer, but we are still not going to be community-based. And the idea is, maybe if we want to go further, the goal is only to foster the creation of sex workers-led organization, and that's what we are actually trying to do. And I wanted to show some example of things we are trying to do, because we shouldn't be there as an INGO. Sex workers organization should do the job, actually, like service delivery, but also advocacy, because, as you know, sex workers do it better. So that's what we are trying to do by fostering the creation of sex workers-led organization. So the first example would be like the Jasmine project in France, which is a platform where sex workers can report offenders in order for their fellow sex workers to protect themselves, to prevent GBV and gender-based violence against sex workers. So there was no platform at all in France at the beginning, but sex workers, they do have a lot of techniques and, to protect themselves from violence. Like sharing phone number already. But it was like a bit confidential. You could get the number when you work like on a website where you pay, and then you get access to the block list, which make it very difficult for the most vulnerable sex workers to get to the list. So we wanted to make it accessible to every sex workers. In order to do that, we worked very closely with the community. Actually, we hired like sex workers in the team, because it's always been difficult for Doctor of the World France in France, because we are mainly working with volunteers. But as sex workers are often very precarious, mostly because of criminalisation, we know that. It may be more difficult for them to work as volunteer in an organization. So it's very important for us to hire community members to develop the project. And now we want to hand it over to a sex workers-led organization, which is a bit difficult at the time in France, because, well, it's a bit of a mess with the sex workers-led organization in France at the moment. So we are trying to create a sex workers-led organization that is going to take over the Jasmine project to pursue it, actually. That's kind of the same thing that we did in Moscow. We have a sex work project in Russia. At the beginning, we worked only with a service provider, like with a community approach. But things they were not sex workers community, so it didn't work at all. They really didn't want to involve really the community except for being outreach workers. And at some point, in a very legitimate way, sex workers began to complain, to say, okay, we can't work with this organization anymore because they just don't want us to work with them. They just want us to do like outreach, that's it. We can't say anything. And for the team, the Doctor of the World's Friends team, it was really a failure. So they couldn't breach the contract with the service provider, so they continued to work with this service provider only for the service delivery, but at the same time they really increased their work with Silver Rose, which is the sex workers-led organization, but in St. Petersburg, not in Moscow. They did a lot of leadership training with sex workers in Moscow in order to foster the creation of yagotki, which means, I think, the berries, something like that. So the yagotki, they recently registered as an organization, like last week, actually. And they got technical support from Doctor of the World France, like organizational strengthening, management, networking, and some also a bit financial support. And now we are going to step back because they don't need us really anymore. And that's great. We are really, we find it very great, really great when they don't need us anymore. As well as we did in Paris, like with a Chinese sex worker, as Ting mentioned earlier, we have a project working with Chinese sex workers, the Lotus. And at some point there was so much repression against migrant sex workers, not only Chinese sex workers actually, but migrant sex workers working in the street, that the Chinese sex worker began to mobilize a lot against the repression, because the police arrested them a lot, even after the criminalization of clients, because it began before the criminalization of clients in France, which happened in 2016. But even since the criminalization of clients, there is still this mobilization of Chinese sex workers. So we decided to support the creation of the Steel Roses, because to make it easier for the Chinese sex worker to speak for themselves, to advocate against repression, also in front of like a local authority, but also national authority against criminalization of clients also a lot, because as you can see, this is a gathering from sex workers with a huge banner from the Steel Roses. So the organization was really created to do some advocacy work, not really to deliver services. And at some point, and also because finally the criminalization of clients happened, it was very difficult for the organization, for the Chinese sex workers, because they mobilized so much that it was a huge failure for them. And I mean, we have to keep in mind that they are migrants and they mobilize against like French authority, so to say. So it was even harder. So maybe Ting will say a bit more about that, for them to mobilize. So it was very difficult. So they decided to refocus on the need of the Chinese sex workers community, and to have to focus on health with a broader approach, because Lotus was really focusing on like SRHR, sexual health, and reproductive rights, but not with a broader approach, and not always fitting the needs of the Chinese sex workers. So, and now we are trying to pursue our cooperation, even if it's difficult sometimes. No, I mean, it's interesting also because it may be difficult when you work, you foster the creation of a sex workers-led organization, and then they decide to do what they want, the way they want. For INGO, we're like, but we don't want things to be done like that. And, and so it's a huge source of conflicts between the organization. But still, we want the sex workers-led organization to do the things they want, the way they want, but at the same time, we don't really want, because we're INGO and we're supposed to know better. But we want the sex workers to know better. And I think it's important also to talk about that, because if we can talk about that very openly, then we can do it together better, and it's better for the sex workers movement, actually. So that's also why I wanted to propose this workshop today, because I think it's important to talk about that. About our duties, so to foster the creation of community-led organization, and not only based, and really to work toward our disappearance as INGO, because we are not supposed to be there, and we are supposed really to leave the floor for sex workers. And, well, it's not very interesting. And so my question would be actually today, so what kind of support do you expect from us for the sex workers-led organization? Because, I mean, if we can talk about that, we also need to learn more about sex worker, but okay, what kind of support should we offer, actually? So if you can, so go to the menti.com and 111. I have the feeling that I'm doing an ad, like, but if you can answer, it would be great to this question.
Yeah, we'll give you like 2 minutes to do that. Yeah, clap, clap, clap. Have we got any questions? Okay, so some of you may have noticed it was almost like a test, or it was just me forgetting to do something. That on the earlier slides, there's a QR code that sits on nearly all the other slides that isn't related to one of the questions we want to ask you. It's about whether you want to ask us questions. So some very clever people have already spotted that, because Megan tells me that there's already a question for Sarah. So I'm going to hand over the microphone so that you're not sharing.
No, it's just that because it's going to be easier at the end. No, I don't know. Also because we are supposed to do it now. Okay. Okay. I was trying to avoid, but okay. Technical.
Okay, so the first question we've got is, how did you avoid the pimp law in France to create Jasmine? How did you avoid the pimp law in France to create Jasmine?
The pimp, correct?
The pimp law?
Comment on peut ne pas devenir proxénète pour Jasmine, la création de Jasmine?
We can't avoid. I mean, it's weird, but we are all pimps in France working with sex workers, so we can't avoid that. But until they are going to pursue us, we are not pimp. I'm not sure I can explain it. No, but harm reduction is possible in France, but at the same time, I think we are all pimp, and I mean, but it's kind of, it would be counterproductive for the French state to pursue an INGO working with sex workers in a harm reduction approach, because they know that if they pursue us, fine, we are going to go to the Constitutional Council in France and up to the ECHR. So, I mean, I'm waiting for them to pursue us as an INGO. So that's why I was saying we are not avoiding it. I mean, I'm kind of calling for it, please. No, because it's actually the only way, the better way for us to challenge the pimp law in France, and we really need to challenge it. So we don't avoid it.
Thank you. And available online later. So let's carry on. And there's lots more of these kind of questions coming up. But as I said, if you've got questions for us, just put them onto the Menti as we go. So this is the bit where our favourite people, Becca and Megan, get to take over for a bit.
Yeah, it's me.
Our less favourite people.
Back to me again. As I said before, I led the project that we called the SWAN project. It's an acronym actually for Sex Workers Analysis of Health Needs, that we're going to talk a little bit about, and really going to privilege Becca and Megan's perspectives in this as the co-researchers on the project. I just want to acknowledge the quite extensive team that we had of researchers working on the project, and credit to them for the respective bits that they led on and made happen. The SWAN study was funded by Birmingham City Council, so that's one of the boroughs right in the middle of England, quite a big conurbation. And they were interested in how essentially they were interested in how the local council could better address the health needs of sex workers in the city. But actually, looking at one city is quite limited. So although we have delivered on what they wanted from us, and that's something about Birmingham, we were very keen to put that in a much wider context of England, and actually, for some of it, globally. So there were 4 different parts to the study. The first was a literature review, and I was very interested to hear about other colleagues who are undertaking literature reviews in this space. In fact, we had 2 literature reviews. We had a scoping review also, and we also had a systematic review that looked at different interventions, different health interventions in England for sex workers. We also undertook a quantitative analysis, so that was looking at really big data, epidemiological data, a lot of which focused on health and social aspects of well-being as well. And then we undertook some qualitative work with interviews with sex workers. We actually conducted 20 interviews. Elle had a very prominent place in that. And with staff who work within organisations that either exclusively or predominantly offered services to sex workers, or that included sex workers. And then we had an ethnographic element to the study as well, whereby we did some kind of deep exploratory and ethnographic style work with 3 sex workers over a period of time. And to be included in any of those second 2 parts of the SWAN study, the sex workers had to have either lived or worked and or in Birmingham. I want to reinforce the fact that although we've got some very interesting and exciting findings from the study, because it's just completed, we've just submitted our final reports, and we will be progressing with publications, but I'm not going to focus on that today. We have deliberately erred away from talking about the study findings, because we want to privilege the participatory approaches, because that's what we're all here to do for this particular workshop anyway. So in the context of the SWAN study, the reason why we decided to embed within the research a co-produced model of researching is because we were really keen, really, to bring the voices of sex workers to the fore, and to privilege this notion of co-production and co-research. And that can mean so many different things, as can participatory approaches. I mean, I'm interested in participatory approaches in research specifically, and there are different ways that we can do it. And we can do it very badly, I must say. And it can be very tokenistic if we're not careful as academics with the way that we think about, interpret, and actually enact co-production. So in the way that I understand co-production and co-research is to say that as an academic working within a university, a space that can be very elitist, hierarchical, and generate knowledge that could be very remote from the real world. My viewpoint is that we need to work with people who are kind of living the life that we are investigating. So people with lived experience, basically. So essentially, in the SWAN study, that involved working with sex workers themselves to bring lived experience to the study. And just before I move on to handing over to Becca and Megan, just prior to embarking on the SWAN study, I'd led another study that was with survivors of sexual violence. And I appointed, or not employed, but appointed 5 co-researchers, all with lived experience of sexual violence, to that project. And that was after about 15 years of working on a number of different projects with people with lived experience of whatever it is that I have been investigating over those years. So in the context of this study that you're seeing the kind of infographic material of, this was really co-produced, co-designed with the co-researchers on that study, and you're going to see something similar to this later on when you hear from Becca and Megan. And what I want to say is that this was the 5 co-researchers working with an artist to capture their experiences of having been part of that project. And I heard one of the presenters just before coffee saying how important it is not to just focus on our academic publications. They're really important, but there's so much more to convey into the community, back to different sectors, different organisations. And this was one way that those 5 co-researchers communicated their experience and the power of co-research. So that's the context of the SWAN study, and I'm now going to hand over to Becca.
Thank you. So we want to start off with a question. So obviously we've both co-researched on it, and we'll tell you a little bit about our experience and what we were involved in. But what ways do you think sex workers can be involved in the co-production of research? If you were planning a project, what ways would you want to be involved, or what ways would you involve sex workers with lived experience?
Can they talk to each other?
And you can talk to each other. You don't have to sit in silence and answer it. You can discuss it if you want. We're going to answer that one anyway. Yeah. I'm just trying to track mine with what's going on. I'm trying not to skip too far forward. Do you want to talk a little bit? Or do you want to do this one then?
I really want to do that one.
I'll finish off it. So some of the stuff that came through was pretty much what we did. So throughout the project, we were giving feedback on the interview questions. We were helping recruit participants and providing feedback for the ethnography and the findings. And we were also involved in writing part of the final report, which I think was really important, because it wasn't like we were just there to give feedback. It was like we were actually part of the team. We got to write part of that report. You know, our lived experience was as valid as the researchers on that team. So moving on to the next question, as it's very question heavy, we're going in with the questions. What do you see as the risk or possible negatives of co-research? Again, you can talk.
responses are in, then we can just leave that up and have a bit of a discussion.
Okay.
We can just use our slides as you can
Yeah.
slide from here.
Okay.
Okay, so when we were with co-research, there is going to be a bit of a power dynamic there. As with us being sex workers, we had no experience with anything like this before. We had nothing to compare it to. We didn't really know what to expect in some degrees, especially, well, Becca was doing a PhD, but for me, I was just a sex worker, and I wasn't really sure what I was going into. And one of my biggest worries was, what is the stance that these people have on sex work? Like, am I going to be participating in something that could actually harm sex workers? Like, are they going to be Nordic model supporters? That was a big worry of mine. And could it potentially be something that ends up conflating sex trafficking and sex work and ultimately causing more harm to our community? Luckily, that wasn't the case there. And also, it's just a very vulnerable thing to do, especially if you're a sex worker who isn't like an out sex worker, because you're using your experiences to help navigate this situation. And yeah, it's just very vulnerable. And when you don't know what the outcomes are going to be, and you end up putting your name on this project, it's like, am I going to end up outing myself for something that's just going to cause more trouble for my community rather than making health services more accessible? So you have to have a lot of trust in the people you're working with. And yeah, I think it was really beneficial to have multiple sex worker co-researchers, because then we could just kind of confide in each other. And yeah, we both came to the agreement that, like, this is a good one. We're doing good.
We didn't pay them to say that bit, by the way.
No.
Yeah, I suppose a couple of my concerns when I started was kind of being brought on as a sex worker for validity purposes, but not being treated as equally, because I'm kind of sitting in a weird position where I'm entering academia as an early career researcher, and I'm kind of dealing with power dynamics between me and interview participants, and I kind of end up on this project sitting somewhere between being a researcher but being there for being a sex worker. So it did concern me that other people on other projects might find that you might be brought on, so the research seems valid, oh, we've got sex workers as part of this, but you might be kind of kept to the side of the project or only used for certain parts, whereas I think to create equality and to break down those power dynamics, you really need to be treated as part of the team. So what we wanted to go on to ask you is, how can we ensure equality between researchers and sex workers when we're working on projects? Again, you can talk.
Yep.
Yeah, the people asked that.
Oh, have they? Don't scan the bits where okay.
Yeah, I should have added that on this.
It's probably because it's been like 4 different presentations and things keep moving between slides. But the codes are there, which should work. They just don't make life as easy. I'm here for technological support, but I'm not actually very good at it. It's the best of the bad bunch. Oh, there we go. Yeah. I'm not sure whether I can make it bigger. And I don't know why it's put those colours on either. But I can tell you, because I can probably read it better from here. So the words that for some reason Menti has decided to use pale green on green. Oh. They obviously didn't like me talking about them like that, did they? There was stuff about transparency, which this is not. Have we? Oh, okay, it's them, not me. You've got to love technology, haven't you? Doesn't it just make life so much easier? I have actually got pens. I could just write on the board. It's not going to do it, is it? I can see a little... There's a little circle of death. Yeah, let's do that, because otherwise I'm going to stand here and stare at the wheel of death for a bit. I am clicking next.
It's fine, just read it.
Okay.
Yeah.
So, the things that we found important to create an equal work environment were good communication and regular meetings. Like, we had regular meetings with the researchers and co-researchers, and then we would also have we would have meetings with all of us. And as I mentioned earlier, me and Becca having our own private meetings where we would kind of discuss everything, and we felt like we could kind of like just breathe a little bit and communicate with each other about how we were finding everything and how we were interpreting everything people were saying, and also being like, are you getting any swerve vibes? I'm not getting any swerve vibes. So yeah, I think that relationship was really important, and I don't know if I would be as confident if I didn't have our meetings together. And also, what we didn't put on the slide, but is also very important, we got paid.
A lot of people
Yeah, so we got paid, and it was very transparent, and yeah, so I'm happy with that. And we were listened to as well. It wasn't just like being spoken at and our opinions ignored. You could tell we were listened to every step of the way, and having that consistent communication and transparency really helped, I feel like.
Yeah, one thing I wanted to say on that was, like, for example, one of the concerns was, is our lived experience going to be as valid? And, you know, when we were given the final report, we were asked for our opinions on it, and every suggestion that I made to what needed to be changed, or terminology that didn't seem correct or might confuse trafficking with sex work, or using the words empowerment, things like this that are problematic, it was listened to. Everything was listened to. Everything was changed. And I think that is what's important, because I could picture being in a position where they just went, oh, okay, yeah, that's fine, and just carried on with the way they wanted to do it. So I think really listening to and treating lived experience as valid as academic experience is really, really important.
Okay, so our final question then is, if you are a sex worker, would you consider being a co-researcher?
That's a really good question, actually, because this was originally set up as like a two-part question, but we're going to zoom through the rest of it because Ting is going to talk to us about his experiences, and also we know that we've got questions from you. So the follow-up to this was kind of why wouldn't you? So actually, I would say that this question would not be based on a best-case scenario. This would be based on a, if you don't know the team that you're going into, would you do it as a sex worker? Which is, yeah, and it is. It's kind of, it's one end to the other, isn't it? You know, because you might think absolutely not. Even in best case scenario, it's not something you're interested in. Or it might be much more of a kind of caveat, like, yes, I would, but only if these conditions are met. And I guess one of the things that we're talking about today for this workshop is what are the conditions that we think in the SWAN study we have met, which ones did we miss, and you know, which ones have Sarah Marie and their team got right or missed. But it's almost kind of starting from a blank slate, like, you know, if you didn't know any of this, would you agree to do it if you weren't sure what team you were going into? And obviously the technology is going to let me down again. I'm going to guess that a lot of people might just say maybe. Oh, don't make me log in. That's quite nice. Yes, I did, yeah. So maybe I've biased the results, which isn't very good science, is it? Which is why I do qualitative research, but then there's still bias in that as well. And then I'm going to get on a whole feminist soapbox, so I'm going to stop before I start. But I mean, that's a good thing, actually. That's overwhelmingly positive, because I think sometimes as researchers, there's a worry that people don't want to be involved, and certainly from an ethics perspective, we get quite a lot of pushback about re-traumatizing people, which is the last thing that we want to do. So having kind of, I realize this is not a kind of scientifically valid study, but having evidence that indicates that actually people would be interested if we get it right, kind of still goes to the, this is something that we need to be doing, and you can't do good research about people without the people who are involved. At which point, we're going to hand over to Ting, and he's going to talk about steel roses in China and France.
Thank you. Hi. Thank you. So I'm just going to show you an example about our projects, and I'm trying to combine the, what Sarah Marie mentioned, how to work with ONG as a community association and the health issue for sexual workers. And so, as I said, we are all migrant Chinese people, and most of us are undocumented. So it would be hard for us to talk to the authority and the government to do an aggressive way of advocacy, because I'm not going to your house and tell you how to decorate your house. So we're just going to sensibilize the consequence about the law you are making and the situation about us, and let the ONG do the aggressive advocacy job, all right? It's our main idea. And in order to better represent our community, we cannot just stay at the level, advocacy level. We have to do real stuff. We have to do real projects. We have to know better about our community. And then when you realize that sexual workers, actually, when you are migrant, you are not protected. You don't have arrêt de maladie. When you yield, you cannot get, you cannot get, when you get employed, you don't have social protection in French society. And mainly of ONG, they do sexual health focused. So, but as a sexual worker, you have plenty of issue. For example, you can get cardiovascular problem, and you can lose your ability to work, and that is not protected by the society. And we're an aging population. Most of us are above 50 years ago, and some of them are 17, and they still work in the street. So there is a more and more health issue with our population, and that's why we are creating this project about called U-Care. It's a fund. So basically, we gather money we put together to protect the sexual worker who lost their ability to work. At the beginning, we are focused at cancer and breast cancer and uterine cancer, because when you know that you are going to have uterine cancer, the whole idea is how can I gather most of money so that I can do the operation and I stop working. But during this time, you are willing to take a risk, because your whole idea is how can I make more money in the short time. So you are willing to do anal without protection. You are willing to work with clients that usually you are not willing to. And this kind of situation expose the risk, and you will be more isolated because you will feel ashamed to talk about your situation. And that's why it's crucial for the community to intervene, to reach out this person and to work with them and to provide the protection. So that's why we crown this fund. And most of the funding in French, it's HIV basis. So it's not, you are in a more global health issue. It's very difficult to find money. But we are going with this argument, say that at this moment, the people is going to take risk, and if you don't protect them, they are more exposed to disease, sexual transmissions, and HIV. And it's important to protect the people in precarity. And that's the ONG come to work with us and say that, hey, actually this is the message. You have to talk with the decision maker and let them involve to this project, because they have duty to protect your community. And that's why we're working together with this message to say that in order to, with the case of COVID, they impact the whole, health, sexual workers' health, and you have to protect us with a vision of health more global and not just sexual health basis, right? So, and actually the women from our community, they are more willing to talk with the media because they know how to, we get this message more clearly, and they know how to sensibilize our situation with the media. So I'm just sharing this project with you in order to let you know how we can better work with the ONG and for the aspect. Thank you.
Yeah, we've got some questions now that I think are directed towards both of the projects, so I'm going to hand over to Megan.
Okay. So the first one is, does Jasmine take reports from Swiss sex workers, or is the platform open to Swiss sex workers wishing to screen French clients?
It's only for sex workers based in France, because we also need to be able to refer them to a support organization after they face, if they want to. So that's why it's only for sex workers based in France at the moment. But maybe you want to add something.
I just wanted to add that before going on maternity leave, I met with some Swiss colleagues from two organizations who want to set up a similar one in Switzerland, but also who told me that they and some sex workers report clients putting them just up beyond the border. Like report something that happened in Switzerland on the Jasmine side, locating them just in France, just after the border with Switzerland, in order for Jasmine to have these numbers, even if they're Swiss numbers. So you may find some clients who are with Swiss numbers on Jasmine. Is that clear? Did I explain? Okay.
And also, I mean, I think we can also quite easily share the code of the website if somebody is like willing to implement like a kind of a platform in their country. It's like in a copyleft way. I think it's easily feasible.
Okay, and the next question is, how can organizations ensure that they don't only include sex workers with more privilege, i.e. citizens/documented, able bodies, speaking the local language, and their needs in the creation of services?
Actually, we can't. It's very difficult to, I mean, obviously when you're more privileged, it's easier to mobilize and to engage in an organization, and it's very difficult to foster the creation of a sex workers organization with the most vulnerable sex workers, especially migrant and documented migrants organization. So we can't ensure that, but we are trying, like by some, if we can and how we can, paying sex workers also for their participation in the creation of the organization, and because once the sex workers organization is created, it's quite easy because we can get some fund and they can get paid, and it's not only for like privileged sex workers, but at the beginning, while we are fostering the creation, then we need to get sex workers paid, so we don't reach only the privileged sex worker, I would say.
Okay, so what's your stance of remuneration and co-production? What are the pros and cons?
I think we should put that together with someone else asked as well, are there alternatives to financial compensation? So I think obviously sex workers should be paid if they're doing co-production, but also there are other ways, and we didn't mention those. So with Birmingham, they offered us training as well, so one-to-one training on qualitative research, one-to-one training on different forms of research, also reached out to us like help with CVs, anything like that. So they did offer other things other than just financial.
Okay. What did the team/organisation do to earn or live up to the trust you needed to put in them? I think going off from what was said earlier, I think just having that transparency and like consistent communication really helps. Like, it didn't ever feel like an us and them type of thing. It felt like we were just all on the same page. Anything you want to add to that? Yeah?
Can I, sorry to interrupt, but could I just ask Becca and Megan to explain the slide that's on the screen at the moment, because I think it's probably of some importance and also maybe relevant to a couple of those previous questions.
So the illustration we've got on screen at the minute is based on something me and Becca were talking about, which is like how you have the two stereotypes on where it's like an extreme on either end of the spectrum. You have like the empowered sex worker, like Belle de Jour type, that swerves love to go on about and shut people down with. And then on the other end of the spectrum, you have the exploited sex worker which is kind of used to strip autonomy from sex workers, as if we're not able to make choices for ourselves. But in reality, the majority of us are in the middle. And a lot of us have kind of gone from one end to the other, but most of the time we're just in the middle. and we don't need rescuing or anything like that, and we're not all buying like crazy designer handbags.
Yeah, and I think that was one of the key things that we sort of found that came out in the research and co-producing it, was because the SWAN project in Birmingham wasn't, they're not sex work specific researchers, they are health researchers. So we were coming from two different spectrums, and we really needed to get these points across. And I think on the question of diversity, this is something we've spoken about as well. I mean, we are both white women. We don't represent the whole of the industry. And I think we had discussed before, how do you get these kind of things out? That's something to think about as well. If you want to co-produce with sex workers, where do you show it? Like, how do we find it? Because we both found it on Twitter, but we're privileged enough to be sitting on Twitter and find it, and the people that you want to talk to may not be. And to make sure it's diverse enough, you need to find other outlets to reach people. So that's another thing that we think researchers should think about when they want to co-produce stuff.
Okay. Yeah. Okay. So, as academic researchers, how do you get the person you're interviewing to trust you and to believe in your work?
Yeah, I just don't want to have the last word, but I think that was a question about, how do we instill that trust? Because trust has been mentioned quite a lot today already, and I'm sure in previous days, but I think a lot of it is through reputation and also through gatekeepers. So I know that you both said that you'd become aware of us through Twitter, but I think also we also try to recruit through trusted agencies like our partner organisations who were working either directly with sex workers or with services that were provided that included sex workers, and so we try to recruit through those channels as well. Yeah. Yeah. So, and then that kind of illustrates actually that the appeal wasn't so much through that kind of broader social media, but actually through organisations who had some credibility in the field. But I think most of the trust is built on the actual relationships themselves and meeting. I mean, I must say that this is the first time we've actually met as a team face to face, and that's not within the kind of broader context of the workshop, but actually within the SWAN team. So this is the first time that Eleanor and I have had the privilege of actually directly meeting Megan and Becca, because we've been working remotely. But nevertheless, that said, we can build up that trust both ways, actually, but predominantly the trust of the co-researchers in us as the academics to try and get it right, and also to be humble and to know that we don't always get it right. And you're quite right to point out you've put us right on a number of things, because that's a really important part of your role. So I don't know who does want the last word, but I don't want it.
Has anyone got any more questions? Because we haven't got a slide up with a QR code for questions.
No, there you go. That's the end.
Any more?
And that's the last word. So if there are any more questions, send them through.
Yeah.
They'll come
You can
through
also-
committee, and we'll have access, and we can send them over to Sarah Marie as well. And obviously we're around for the rest of the day, particularly for the Prosecco season.
Thank you.
Thank you very much, everybody. The panel has finished, and let's go to eat, because otherwise it's going to be late and we will have to eat like super quick. So we are in perfect time. So go to the first floor, see you there, and have a bon appetit.